Good morning, everyone. Thanks for joining us on April 1st, 2024. It's April Fool's Day. I don't have any tricks or pranks planned. How about my coworkers at the State Health Insurance Assistance Program, SHIP, Melanie and Megan? Do you have any pranks planned for today?
No, excuse me, no jokes here, but just, just wonderful, accurate Medicare information as always, right?
Same here.
Well,
Good
terrific.
morning,
And
ladies.
today we are going to talk about the No Surprises Act. And that's all about how some people, they would get a service and then all of a sudden here would come a bill and they didn't understand why they were getting that bill. So the government went to work to put in some protections for consumers. So Megan has put together a terrific presentation for us this morning. I invite everybody to chat in their questions. And even if you're watching this after the live show, you can still ask us questions and we will respond to you. So these are posted on YouTube and we'll be staying on our Facebook page. So feel free to interact with us live or after the fact. And you can also tell folks that might be interested in this that they can check in with us and get some great information. So Melanie and Megan, why don't you take it away and we will begin our presentation this morning.
Sounds good. Thank you, Susan, for the wonderful intro. So we're going to talk about the No Surprise Act this morning. We're going to talk about what it is, what it isn't, when you shouldn't get a bill, and when you may still get a bill, because even though there's this act, there's still some loopholes to it and some certain circumstances that are not still protected in this act. So what is surprise billing? Well, this happens when a patient receives a balance bill after unknowingly receiving care from an out-of-network provider or an out-of-network facility, such as a hospital. Could also be a nursing home, other medical facilities. And this can happen even if it's an emergency situation or a non-emergency situation. So now let's talk about what is balance billing. So balance billing happens when a healthcare provider bills a patient after the patient's health insurance company has paid its portion. The balance billing is for the difference between the amount the provider charges and the price the insurance company sets after the patient pays any copay, coinsurance, or deductible. So this balance billing is on top of our normal copay, coinsurance, or deductible. Now, I found when putting this together that data showed that 1 in 5 emergency room visits and 1 in 6 in-network hospital admissions potentially led to a surprise medical bill. That's a lot. So the No Surprise Act came in play in about 2002. And this federal law prevents or provides protections from emergency out-of-network bills, including air ambulances. Now, keep in mind, I mentioned air ambulances. We're going to talk a little bit more about our regular ground ambulances in a couple slides. And then non-emergency services at an in-network facility. So again, this started in 2022, so it's been in play for about 2 years. And it applies to self-insured health plans. Sorry, I had to move my camera out of the way. Health plans offered by employers and health insurance companies. This does include Medicare plans. A facility or a provider may not bill you more than your in-network cost sharing amount for emergency services. So your copay that's set, the deductible that's set, the coinsurance that's set. You are still subject to those amounts, but nothing that would be surprising. This is true even if the emergency services received were at an out-of-network facility or performed by an out-of-network provider. So a couple other things to note. You must receive notice of your rights under the new law from your health plan and from the facilities and providers that you serve. I don't know about Susan or Melanie, but every time I go to a doctor or like an outpatient surgery building, I see posters for the No Surprise Act. And a couple times they've tried to provide me with the paperwork. Well, I've got plenty of paperwork, so I say, no, I'm good. So you don't need to take it, but if you have not received one of these before, if you have not read it before, if you have not seen it before, I do encourage you to take it at least the first time. And then after then you can say, no, I'm good. Let's see. Where was I? I lost my train of thought. If you think the protections have not been applied correctly by the facility or your provider, you can appeal this. You may want to call SHIP first to kind of talk it through to see if it's an appropriate billing or not, but you can appeal regardless. You would appeal with your insurance company or request external review from the company's decision. You can also file a complaint with the Federal Department of Health and Human Services. So what else I found, and this was new to me, I hadn't realized this yet, but ground ambulance. So that's the ambulance, the ambulance like a vehicle. Services are not covered by billing protections in the No Surprise Act. So they're still allowed to charge out-of-network rates and cost sharing. Now, some states have state laws that say no to the cost sharing outside of the copays and deductibles. Indiana is not one of those states. So No Surprise Act does not have anything to do with ground ambulance. So you could still get a surprise bill by an ambulance ride. And I actually did a couple years ago. It was actually in 2022, but I think, ladies, do you remember what month the No Surprise Act passed? It was probably the summer, but I guess it could have been January. We don't know. But I had gone to an emergency room, but that emergency room couldn't treat me to the extent needed, and I had to go to another hospital. So they called an ambulance, and I got a bill a few weeks later for $800. And it said that it was only partially covered and most of it was denied. So this would be an example of surprise billing. And now I did appeal it because the reason why they denied it was because they took me to a hospital that was not the closest to me. But I had already been at the hospital closest to me and they couldn't treat me. So I appealed it and things got fixed. But we could still get ambulance bills like this, surprise billing for ambulances. So ladies, before I continue, are there any questions?
Great job, Megan. I just, was just gonna kind of go along with what you were discussing. And
Melanie, you're breaking up a little bit.
Uh-oh.
Oh, now you're better. Now
Can
you're
you hear
better.
me now?
Yeah.
Okay. But I was just kind of going along with what you discussed earlier. It's just, it's never wrong to call your insurance company and discuss those bills with them, and just to make sure that it could have been something on the provider's end that may
Mhm.
have not been entered correctly, or it may have been something just like in Megan's case that the insurance company reviewing it didn't understand the situation. So don't ever get fooled by those bills or even your evidence of coverage or your summary notices. It never hurts to call and clarify. So just a reminder on April Fool's Day, don't let yourself be fooled or get
Mhm.
scared into those big sticker shock numbers sometimes. Don't ever be afraid to just call and clarify. And that's something the ship counselor can review your bill with you as well and look at that and explain what was billed and the coverages and things like that. So just wanted to kind of throw that in there. And then one question we had pop in, Megan, was we have a gentleman that's on an HMO. And
Mhm.
so we know, ladies, that there's different types of advantage plans, and the HMO specifically say they're in network coverage only. So how does the surprise billing work with HMOs?
Very good point, Melanie, to, check your statements and don't be afraid to call. And very good question. So yes, HMOs are a little bit different with the No Surprise Act. So an HMO plan, for those that don't know, means in-network coverage only. So if you go to an out-of-network provider, you are generally stuck with that bill 100%. If you have a PPO plan, then you generally have the ability to go in network or out of network. And if you go to out of network providers, there's still going to be coverage. You're going to pay a little bit more, but you're not going to pay 100%. Now, how does HMO plans work with the No Surprise Act? HMO, from my understanding, and ladies, correct me if I'm wrong, HMO plans trump, in most cases, the No Surprise Act. So if you go to an out-of-network provider and let's say it's just a doctor's appointment, and you have an out-of-network primary doctor, that is most likely not going to be protected by the No Surprise Act. But let's say you go to an emergency room that is not in network with your plan and you have an HMO. And if it is a true life or death emergency to go to the emergency room, then there are going to be protections then, because HMOs do have in place saying that if you have a true emergency and you go to a provider that is not in network, like an emergency room, then there will be coverage. But I know the definition, at least from what I've seen, is a little bit strict on what is an emergency. Just because you're going to the emergency room doesn't necessarily mean it's a life or death emergency. If you're going in for, oh, I don't know, a severe cut on your finger and you need stitches, and it's an HMO provider, that is not a life or death emergency in most cases. But if you're going in because you were in a car accident and your injuries are extremely severe, then that's different. That is a life or death emergency in most cases, and there will be protection with HMO plans. So that's what I know about HMOs. I hope that answers the question.
Perfect. Yes. And really, the lesson here, folks, is if you can call and double check that those entities are in network, and knowing your providers as far as hospitals and urgent care goes, to just make sure that your insurance is going to cover that. And typically ER and urgent cares are covered, but it never hurts to just double check and make sure.
Good
All
point.
right. Thank you, Megan.
You're welcome. The other thing I'll mention is, oh, I lost it. I had it when Melanie was talking. So if you get referred to another doctor or surgeon or medical facility from another doctor, don't assume they are in network with your insurance. I hear from clients all the time, well, they're going to refer me to a specialist. And I tell them, well, you better double check it's in network. And I hear frequently, well, my primary should do that for me. They should, but they don't always do that. So you do want to make sure when you're referred to someone new, when you're calling to set up that appointment or they call you, it's important to ask them, do you take this plan? And keep in mind, if you have original Medicare, you can just say, do you take Medicare? But if you have a Advantage plan, you need to be more specific. So, do you take this United Healthcare PPO Choice Plan 1? And they will let you know if they do or not. And if they don't, then you decide if you want to continue to see them with your PPO or HMO, or if you want to be referred to someone else that is in network. So just wanted to throw that out as well. So that is our No Surprise Act presentation. Are there any other questions in the chat box, or are we good, ladies?
I don't have any. Susan?
Okay. Susan, are you good?
I don't have any either, but I will just share a terrific resource if people want
Yes.
more details about the No Surprise Act. The Kaiser Family Foundation, KFF.org. It has a terrific article on the No Surprises Act and a ton of details.
Yes, thank you, Susan. That's actually where I found my data on the 1 in 5 and 1 in 6 that I shared earlier. I couldn't remember where I got it from. But that's where I got it from. So thank you, Susan.
Right.
Yeah, that is a wonderful site with great information.
Yeah, we have some information on the in.gov site as well, the Department of Insurance and the SHIP site. And of course, you can always go to medicare.gov to read some additional material.
Perfect. And you can also call us at Indiana SHIP, and we can assist with your questions regarding a bill you got, regarding billing, regarding No Surprise Act. We are always happy to help. Our SHIP helpline is posted on this slide. You can visit us at medicare.in.gov, and we are on social media. We are on Facebook, we tweet, we YouTube, and we are on LinkedIn. So if you need us, feel free to reach out to us. We are always ready here to serve. And you can also, like Susan said at the beginning, you can comment on the video and we monitor that, or you can go to your Facebook Messenger and you can message us and we watch that. And we will respond and comment as appropriate.
Thanks, Megan.
You're welcome.
Yeah, this is terrific information. And Melanie's going to wrap us up with some our schedule for the rest of the month. So what's happening with our Facebook Lives in April, Melanie?
We've got a great lineup this month. So next week, our What to Know Wednesday is going to be all about volunteering for SHIP. So we are very much supported and ran by our volunteers and our counselors and our community partners throughout Indiana, and April is National Volunteer Month. So that is the theme of our presentation for What to Know Wednesday. So catch us on the 10th. And then the next week, our Medicare Monday, we are doing a series of the ABCs and Ds of Medicare. So Medicare can be alphabet soup. So we thought we would just separate it letter by letter. So we're starting out at the top of the alphabet with Medicare Part A on the 15th. So catch that to learn all about costs and coverage with original Part A. And then we are going to round the month out to show some appreciation and just general information on National Minority Health Month. So we will feature a speaker that month, and we're just going to talk about the minority health programs and information that's available in our state. So you don't want to miss that one either. So I think that's enough, ladies. We've got a packed full month of great, informative, and hopefully fun presentations for April. So thanks for joining us this morning. And like the ladies said, you can catch us. You can catch these presentations recorded on our website, or on our Facebook page, I mean. And I'm going to continue to drink more coffee this morning. But yeah, so don't be fooled by any bills that you receive, and just know your rights, know your protections, know really it's best to call ahead and make sure, if you can, that your providers are in network before you go, so you don't get surprised by those bills or fooled by those high sticker costs. So thanks for joining us this morning, and we'll catch you next week on Wednesday the 10th.